Hello, everyone, and welcome to RMD All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst. So I am a ER physician turned anti-aging regenerative specialist, and I did that because I was working in the ER for approximately 25 years and just was starting to notice some changes with age, and all the traditional solutions were non-existent. So everything looked good. So basically, as I began my anti-aging journey, I realized there's lots of solutions. And so my mission in launching Revitalize MD is to bring those to people comprehensively to help them look, feel, and function better. And with the RMD podcast, I would love to get that information out to more patients and help people find those solutions they're looking for. So today I have two guests with me, and one is Samantha Addis, who's been with me multiple times, and then Matt Ferris as well. And I'm going to go ahead and let them introduce themselves.
Hey everyone, my name is Samantha Addis. I am the office manager at Revitalize MD. I work very closely with Dr. Durst on a daily basis. So my main goal is to make sure that the patient experience at Revitalize MD is top notch. And here we have Matt with us today.
Matt, do you want to go ahead and introduce yourself?
Yes. Hi guys. So Matt Ferris with Lutronic, and we're a device manufacturer. So all things skin, we're the expert, we feel, in that field. So, excited to be here and talk about some lasers.
Yes, and that's exactly what we're going to talk about is Lutronic. And again, he may have to correct me a couple times. I always added an S to it.
It's not Lutronic.
That was perfect.
But Lutronic Ultra is where we're going to start today. And then we can talk about the different, modalities and devices they have. But we actually will frequently do what's called a Lutronic UltraGlo event, where we bring people in and kind of educate them on the Lutronic and all the amazing services it does. So I'm going to let Matt talk about that. He doesn't necessarily have to focus in on the UltraGlo, but what the Lutronic Ultra does. And then we can touch about, on the UltraGlo and how that differs and, those pre-event services that you can get. So tell us a little bit about the Ultra.
Yeah, so
like you did us the first time. I love the device. So
yeah, hands down, it is a favorite device of all of our owners. So in all of our practices. So the Ultra is a thulium device. It's a 1927 nanometer wavelength thulium device. So it's a fractional non-ablative. So basically the best way to say that is we're able to address skin tone and texture with almost no to very minimal downtime. And those are the key things. So we can treat all skin types all year round, and most people are familiar with an IPL and, attacking some benign pigmented lesions, whatever it may be. Well, we can do the same thing, but also get the benefit of some light resurfacing.
Very nice resurfacing, in fact. So when you talk about fractional non-ablative, and we've hit on this a couple times just with resurfacing, because again, I don't think people talk enough about resurfacing. Mm-hmm. And this device does an amazing job at resurfacing. And so when we're talking about that, we're talking about, again, I say, denser scratches, fine lines or wrinkles, mm-hmm. Pigment, pore size, texture. But when we talk about fractional non-ablative, talk a little bit about even just what ablative versus non-ablative means first,
Sure.
just so people can understand that terminology to start.
Well, and I think the easiest way, without getting too far down in the weeds, but, kind of the history of the devices, everybody's known or heard about a CO2. I mean, in my age group, right? I mean, that was back in the day, CO2, mm-hmm. that's what people had done, right? That's what mm-hmm. they knew. The difference is the CO2, like an erbium, are ablative. So they're removing that tissue. And so what you're doing is a lot of wound care and a long period of downtime. So 3, 5, 14 days, right? Depending on how aggressive they were. So today's age and the treatments and just the technology that we have, we're able to get those types of results, but with almost no downtime. So minimal downtime. So maybe you need, 1 to 3 treatments versus 1 treatment, but most people nowadays can't sit at home for 10 to 14 days with wound care and not go out in public or want to be seen, right? People want to have things done with minimal to no downtime. And that's what we're able to achieve with a fractional non-ablative. So we can cover more skin by the number of passes that we do and the higher energies that we go to. But the end of the day is we can get incredible results, but just not with the downtime as older technologies.
And so I think that as I started to learn about lasers, again, I spent a ton of time in the ER, and when I, first started, it was more wellness and anti-aging, and then to the aesthetic piece. So I really had to wrap my brain around lasers and be able to dummy it down for not only me, but then to be able to explain it to others. And so when we're talking about CO2, because again, not being in the industry when CO2 was used as much as it was, that is you're ablating, but you're really ablating with that.
Don't they normally put you under anesthesia too for that?
No, not necessarily. And I think to where, that kind of comes in from is that we have a fabulous CO2, right? And CO2 definitely has its place. But typically now we associate that with a plastic or or something, maybe to where they're doing other procedures and they are already out, right? Or they're already under, so they're incorporating that into it. So there's already going to be a lengthy downtime procedure that is kind of paired with. But we know majority, of the patients and people living in a real life that aren't going to be under for some major surgery don't have the time and don't want to deal with it. And there's wound care and there's more risk involved. So it has its place. It's just now we're able to get great, fantastic results. And again, not have to have the wound care that you guys have to worry about the patient following orders at home and the downtime.
So if we're talking about, the skin and the epidermis being about a thickness of a sheet of paper, so that's about as thick as we're going. So even these devices are going to hit deeper than that. But CO2 is going to take that epidermis and go into the dermis. And so again, you're removing a lot of those top layers. And so downtime's significant. It's all resurfacing. But again, you have to have a lot of down. It's awesome. And I agree. I don't think that anybody really does that anymore unless they're doing it with a procedure, because you're talking about weeks of downtime and unpredictable too, depending on the person. And so so we're looking for where we can do it more frequently and then not have the downtime. And so with this, what I love about the Ultra is that we don't ablate with it. So you're not getting that top layer during the treatment, but you're working from the inside out. So you're creating those, micro injury, which brings us to the fractional part. So again, it's non-ablative, not taking anything off the surface, no downtime, not uncomfortable at all. And then the fractional part. So go into a little bit what that means. Because again, the Ultra is a fractional non-ablative. So we talked about what the non-ablative means. Now talk a little bit about the fractional part.
Well, and the fractional, again, really ties into the percentage of skin that you're covering. And that also goes into wound care and downtime. So in the past, we had full ablative systems to where you were ablating the full, like whatever the spot size, let's just use a dime, for example, right? If the pulse was the size of a dime, skin underneath that was completely removed. So what the fractional does is that it puts in all of these small little micro channels within a dime. So let's just say instead of the dime area being completely, the top layer of the skin being completely removed, we're able to put in, let's say, hundreds of little holes in that area. So we're able to affect the skin, but just not as much at one point in time. And again, that way there's not an open wound, the wound care and the downtime and the pain, you don't have that. So,
and then you're creating those micro channels with the laser instead of a needle.
That's right.
Which you're going to do with other, devices and treatments. And so just like the RF microneedling, this one, you're creating it with the laser. And so do you feel like you can put on the same, products and even PRP into those micro channels after that you would with microneedling?
Yeah. And so we, our total skin solution is combining the Ultra treatment immediately after an RF microneedling with our Genius, right? So, but definitely, you can definitely add in, PRP to help with, that wound response and that wound healing response, for the body. It's not a necessity, but it definitely,
Yeah.
patients can benefit from it if they want to add
When
it.
they have the Genius with Lutronic has the Genius RF microneedling. Again, unfortunately, we already had one, but we've talked about microneedling on here and and on previous segments. But basically, you're driving energy into the skin. So instead of a straight up microneedling, those microchannels of injury that are stimulating collagen, elastin, now you're driving energy into it to create collagen and elastin. And so when you pair the Genius or the RF microneedling with the Ultra, how do you do that? So are we doing the same treatment at the end when we're pairing it together for the complete
the same Ultra
solution?
treatment? Yeah. So yeah, we are. So if you think about it, and especially with lasers, you always, and there's some things that kind of go into it, ones that you can do combined therapies with and some you can't, but we're always going to work deep and then work our way up, right? Start deep and then work our way up. So with RF microneedling, we're putting in energy in a direct spot with those needles, right? So it's almost like combining an older type of lifting, energy-based technology with microneedling. So it's, combined into one. So we're getting depth with the needles and we're putting that energy in exactly where we want it to be to stimulate that collagen, right? Skin laxity, tightening, those effects. And then immediately afterwards, we'll do an Ultra treatment. Because if you think about it, RF microneedling is more like the foundation of your house, to where the Ultra comes in and it's a more superficial treatment. And that's going to be your walls, your roof, right? Your fixtures, like just that kind of final polish. So, because RF microneedling is working deep behind the scenes, and then the Ultra is what you're going to see immediately. And obviously, down the road.
And Matt has always been great at educating on even when we have questions about our other devices. He's always answering and providing information. And so I love that, even that working deep and then coming more superficial. And I didn't know if we did like a lower energy with that or whether we would do like the same, epidermal.
So,
treatment.
That's the nice thing about the Ultra is the versatility of it. And, you mentioned the UltraGlo, which is just a lower, power treatment, but it's something that can be used on anybody that walks in the door every day, year round, right? But again, the versatility of the system is really just depends on what their desire is, right? What their expectations are, right? So
what solution they're looking for.
Yeah. We can use any energy level post RF microneedling, just that's based off of the consultation and kind of where they're
So what their problematic areas are,
right.
What they're trying to reach. And so, but still, the nice thing about the Ultra, again, you can go from a very low power pre-event type setting, which is the UltraGlo, and you can go deeper and you still don't have downtime. And
that's right.
And you really can't even see, you'll see a little redness after.
Sure.
Right after, but what procedure do you not see redness? A little bit of redness after. If you don't see redness after something, then you probably
right.
need to have them keep going.
Well,
so
people want to see that it's doing something, but they don't want to be beat up for 10 days plus, right? So,
correct.
And again, back to the versatility of the Ultra is that we can combine it with RF microneedling. We can do the treatment on its own, but we can offer a very nice and like an UltraGlo treatment that has almost no downtime at all and do all skin types, treat melasma, pigment, right? All of those different issues, but we can ramp up the power too. So again, it comes back to the fractional part of it. We can turn it up and do more passes and really affect more skin, but that's going to be, to where they're going to have more downtime. It's still not a fractional or a non-ablative, it's still a non-ablative. It's still not an ablative treatment. So your downtime is definitely going to be much less, but we can get very aggressive with it.
And I kind of look at that when you say downtime, knowing the Ultra and how the patients do with it, I don't really consider that downtime, but maybe that's just me again. So I think that you get redness and the next day it's gone. You'll have some, sandpaper or you'll feel texture, some texture changes. But I think that's something only you notice and no one else does, correct? Right? Yeah.
We always say there's clinical downtime and there's social downtime. So previous old technologies, that's going to be a combined of both,
I
right?
Like that. I've never heard of that before.
So with the Ultra, your social downtime it's just going to maybe be through the next day, just like redness, right? Maybe they don't want people knowing they had something done. Are they going to feel sandpapery? Yes, probably for about 4 or 5 days afterwards, which is completely normal, but you don't see it. Like, you're only going to know that, while you're washing your face. So.
Yeah. Well, and I think that when we're talking about clinical and social downtime, even, it's all become much more acceptable now, right? So even though people never had Botox, didn't know what Botox was in the past, and 10 years ago, nobody was talking about the fact that they did Botox. Now, again, it's a badge of honor to have Botox and to be able to get rid of the lines. And then likewise, I don't think people really get bothered by redness, or even if they're peeling with chemical peels. Yep. To me, I go about my day, maybe like not day 3 when I have, coming off, and, I'll kind of avoid some things, but for the most part, I just say it's going to look better next week, and so, because you don't really have a lot of time, and, society is on the go now, and they just don't have, so I almost consider that acceptable downtime now.
And I agree 100%. Yeah. So before, right, nobody wanted anybody to know what they had done. So no downtime, right? Everybody wanted no downtime at all. Yeah. So I think you're exactly right, though, as times have changed and it's more open and everybody's more educated on it, that they're okay with saying, oh, I had a procedure done, I'm going to be red for, a day, 24 hours, maybe 48 hours. So still, it's not the old issues with the older technologies, to where it's not only it was a downtime, but there's wound care that the patient's having to do at home. You guys are having to manage, so it really takes out all of those issues, right? So if we can offer a treatment that gives you great results, but with very low risk, that's where the Ultra comes into play. And people are okay with being red for a day, 2 days. Let's just say the maximum 3 days. You're really aggressive, but that's still light years ahead of them having to be locked in the house or having wound care and put ointment on their face for 10 days,
so significant healing.
Yeah, a little redness you can hide, you go to work, nobody really cares. And then, a few days it's gone away. So, yeah.
And so the various things that it treats again, which, the resurfacing does is pigment, pore size is huge. So anyone that has some pores that are significant in size and you want to reduce them, it does a great job of that. Texture, and again, fine lines and wrinkles. You almost consider it like a sanding down, like you're just sanding, and we need to do something every 4 to 6 weeks, really, to just keep our skin nice and healthy and vibrant.
And that's where, the UltraGlo is just a phenomenal treatment you could do within those time frames. So
yeah, it's perfect. And so typically you do recommend it in a series.
We do.
I know that and you can tell me whether this is right. We always recommend everything in a series at first, because we're going to resurface and we're going to go ahead and again, you're going to get cumulative effects if we do that in a series.
Exactly.
And you're going to build collagen, elastin. It's going to build upon the last treatment. So we usually do at least a series of 3 and then kind of move them more to, a maintenance. And that maintenance could be once a quarter, once every 6 months, once a year. And again, the UltraGlo you can do pre-event.
Yep.
If you just want to be glowing during an event, it's a perfect way to just get ready for something and look gorgeous while you're going. So
and this day and age, like maintenance, right? So now I'm sure your Botox, your patient base demographic is much younger, because now we know that if we start it younger, right, we're going to have to do less as we get older. So
they just got it right. Like they've been educated on it.
Exactly. Well, that's what it is. It's education. So now they're like, hey, well, if I do this now, I'm not going to have to do X, Y, Z when I'm this age. So yeah, it's just about preventative, and doing things now to take care of your skin, which includes, lasers, not just skincare.
The resurfacing is huge, and people just don't talk enough about that. And again, I think that the younger population, definitely the girls, we got to get the guys on board for all that too, because they need to beautify as well. Yeah. And so we have a lot of guy patients, for a lot of the services we do. So we talk to them about that. It's actually kind of surprising. Like when we do a hair, which we'll talk about a little bit with the Keralase, we'll do microneedling after, and then we end up numbing their face and going onto their face. Right. And at first they're a little shocked. We offer it up, and they're a little hesitant, but we're like, you got to beautify as well. Yeah. And so that moves them right into the Lutronic next, because once they start, it's just like everything else. You know, there's some entry level like Botox, and then once your forehead is smooth with no wrinkles, then you know you want Botox on a regular basis. Again, meaning that's the verb, Botox. But anyhow, so as far as hair, because this the Ultra does a great hair treatment, and again. We do a lot of different things for hair. So we have historically, I've done PRP for years for hair. You know, unfortunately, it doesn't always, you have to have the perfect patient for that. You know, the older you are, the more advanced the hair loss, it's not that helpful. So we'll do exosomes and some other things for it. But what we were doing is injections as well with some peptides. And so now, because that would actually be a little painful because, you know, we'd bring them in and we'd just use the Zimmer for that. And it was a quick, you know, 10-minute procedure. But now what I love is we can use this laser that forms those microchannels, and then we can get the peptides with the Keralase, so without the injections.
That's right.
So go ahead and tell us a little bit about that, because I love this treatment.
Yeah. So again, back to the versatility of the Ultra, but yeah, so Keralase is the combination of the LaseMD Ultra and the Care Factor treatment, which is the peptide complex, as you were saying. So what's nice is that we're able to treat the scalp with no numbing required, and then apply the Care Factor immediately after the LaseMD Ultra treatment on the scalp. So no needles, no blood. It's just a much faster and much more comfortable treatment. And we're seeing amazing results with it. And really the part of that is the Ultra system itself. So we know that we can we can repeat the treatments, right, through the series of package of 6 that the patient's going to need. But we know exactly how deep those little microchannels are going, you know, and adding the Ultra on top of that makes it at least like 7.5 times more absorbent when you're doing the Care Factor. So the Ultra is the perfect system to prep the skin just to become like a sponge. And then once you apply that Care Factor on there, just soaks it in. So very interesting.
Yeah.
technology.
And I mean, obviously the hair follicle has an opening, you know, but again, I am not of the belief that you're really going to get much in without injecting or forming a micro channel. And so, you know, topical, you know, works when the people are doing, you know, the topical medication. That's the only option for that, you know, and so then you have to use it. But otherwise, if I'm going to put peptides on or PRP, you know, there's no point in me just applying it. You're not going to get in. So I think it is the perfect, backdrop for the peptide solution. And so again, Keralase. So Keralase is the actual treatment named. So, you know, so that's where we're doing those microchannels again throughout the scalp. And I forgot about that. Yeah. No topical numbing whatsoever with that. And so sometimes I still think that we were putting on the topical with it, but you don't even need that. And so now instead of injecting, because again, injections can be painful, you know, we'll use the Zimmer, but even then it's quite hard to get somebody completely comfortable with the hair treatments. And so the fact that you have the microchannels there and now you can put the product in, and then Care Factor is the name of the actual product. And so I did a little research on that too, because I was injecting some TB4 into the scalp. And so Care Factor actually has TB4 in it as one of the peptides. So it has multiple peptides and it has TB4 in there. So so I was super excited about that.
Yeah, we've seen amazing results with it. But yeah, it's just a much faster, much, you know, more comfortable treatment for the patients. But again, you know, it's an exact science. So we know exactly what that complex contains and what we're putting into the skin. There's no deficiencies like you would maybe with PRP, you know, in the delivery method, right? It really takes out a lot of different aspects that could go wrong. So, and again, at the end of the day, you guys offer multiple, you know, solutions, and it's not a one size fits all, right? No. So maybe some people are going to respond more to this and this, but this is definitely hands down a fantastic tool that we're seeing amazing results for.
We've actually wanted to do, you know, again, a laser pairing with or injectables, even in addition to an exosome or PRP treatment. And so when patients come in, especially depending on patient selection, so if they're more advanced or have atypical, because some people will also have atypical hair loss, not just a male pattern or a female pattern, or they're more advanced, one treatment isn't going to do it. I mean, I'm not saying that necessarily. I mean, exosomes may, but again, you can never guarantee a response, but when you're stimulating the hair follicle over and over again and putting peptides in to the scalp and then stimulating the hair follicles again, you're more likely to have a successful outcome when you're doing it with multiple modalities.
It's just about being able to repeat that procedure every time. So every time you do it, the energy, we know the depth of the microchannels, that absorption, it takes out any risk or guesswork or user dependency, I guess, as far as doing the procedure.
Yeah, it's an awesome procedure, and they're so comfortable with it. And again, I think you have to hit this from multiple angles, including supplements like a Viviscal Pro, and then the laser, adding the peptides in, doing that every 2 weeks, because that's the other thing it comes down to. It's every 2 weeks for at least 6 treatments. And then usually what we'll do is an exosome or PRP treatment beforehand. And a lot of times we're doing the exosomes with hair and then recommend this every 2 weeks for 3 months. And so it works well. By then, 3 months, we'll kind of know, at least have some idea of response. And then we can also gear it more after that. So
exactly.
Yeah.
That's with this, like you said, with the Ultra doing a package, we know to get XYZ result, we're going to have more than one treatment.
Yes.
Typically, so your skin's going to heal. We're going to affect a certain percentage of it, and we're going to kind of, go down the line with that. So that's why, 3 treatments, I would say minimal typically with the Ultra. Could be more if it's melasma or acne or things like that. Maybe we're doing lower energies, but more treatments, and the same thing with the Keralase. We know that you're going to have to do 2, every 2 weeks, a treatment for 6 treatments total, right? And that's your beginning. There's no more, no less, and let's see where you are. But, you can tailor that if they did see great results, but want to go more, right? There's no reason why you can't.
Yeah. Yeah, no, absolutely. Well, and growing hair is a very important thing to me too at the office, because, I've been playing around with different protocols, even with PRP for years now, even different blocks and numbing medicines and, different ways to block them. And I will just be honest. I mean, it's not always 100% comfortable no matter what we do, but it's worth it because they want to grow hair short of having, a transplant, which is highly expensive, very time consuming and painful. And if they come early enough where there's, not advanced hair loss, then we can make a big difference. But you do need to hit it multiple and just setting that expectation. But I really do love pairing this because my goal is to get great responses in those patients that are appropriate candidates for in-office hair regeneration. So one of the main reasons why I loved bringing this on. And then the resurfacing is amazing. So it was an easy decision and everyone has loved the treatments. And so, again, just being able to tailor that to, a pre-event to, something more severe. I always just say from a simplistic standpoint, we can do a heavier peel or not peel, but a heavier resurfacing treatment. And you have a lot of downtime and you're doing one. And even this, you can get that without the downtime, or you're doing more frequent with less downtime, but then you're just doing it more frequently. So this is one of those middle grounds where you can still go very strong and get a good resurfacing, but not have the downtime. So,
that's right. Yeah. And it's, very versatile. You were talking earlier about, pigment and fine lines and pore size reduction and all of those things. So, but it really just depends on, again, what you're treating. So melasma is, I don't know, millions of people. It's hard to treat, but you guys probably see it every day, right? I mean, it's, everybody, it's out there, right? So it's definitely difficult to treat. And there are not a lot of options to do that. Like an IPL, that's a 50-50 coin toss. You're either going to make it much worse or not affect it, but obviously not a treatment that somebody's going to recommend for it. In the same way with older ablative, to where you're putting in a ton of heat. That's where the Ultra comes in. We can treat melasma. So we're going to do lower energies and more treatments, but definitely help manage it, right? We're not curing it. We're not getting rid of it, but we're going to be able to manage it and really affect that. So from just pigment in general.
What
age
about
spots,
rosacea?
sunspots.
Do you feel like rosacea has
You know, we do see some resolution and just light redness just from the energy being put in by the system. But, it's not going to, it's not a vascular
It's another hard one to treat too.
But for light redness and things like that, we definitely see some improvement over it. But, you think about melasma, very difficult to treat. This is a fantastic tool to manage that.
Agree.
Active acne, you look at age, so I always say skin tone and texture, but as we were talking about earlier, the face, the neck, and the chest. I mean, that's a huge spot. But the hands, the arms, you can treat this anywhere on the body for somebody that has, pigment on the skin, textural concerns.
That is a huge, again, don't stop at the jawline. I have my staff hears me say it every day to them. Right. Don't stop at the jawline, or when you're my age, you'll regret you did that. So I think that anytime anybody's getting a resurfacing, no matter what age it is, you need to talk to your provider about adding on a neck and a chest to that. And the hands are another huge thing. So what ages women as we get older? It is, neck, chest, and hands. So you can add those treatments on while you're there getting your face done. Don't ever stop just at the jawline. Inquire about those add-on services and areas because it's huge.
Well, if you think about it, normal daily activities, you're wearing a shirt, right? People are seeing a little bit of your chest. Your neck is exposed, your face, and your hands. I mean, that's what is aging you is the sun. So if you think about those 3 or 4 areas, the face, the neck, the chest, and the hands, I mean, that's definitely something I would recommend them treating every time they come in. I mean, and they can. It's super quick, very comfortable, very easy.
And then it's never a one and done. That's another conversation we have frequently. Like we already have talked about a series, but again, doing something every 4 to 6 weeks to address things. And once we're over the age of 40 or we're noticing skin aging, then you really need to be doing something every 4 to 6 weeks. So even if you did a series of these and then you added a peel, or you did the RF microneedling, or you did microneedling, but then you're back to, doing another ultra or doing another Laser MD, then, you have to be doing something. It's never going to be, unless if you've been on it since you were age 20 and been on some retinal products. Other than that, you can never expect that it's going to be treated with even just a series. You really need to be doing something every 4 to 6 weeks, and then you will see a huge improvement. But you got to set those expectations for sure. And then I love when people are always ask, no matter what it is we're doing, if it's how often, or is it like a permanent? If it's is it permanent?
Yeah. And how long is it going to last?
Yeah. I mean, we're not even coming close to saying that the Lutronic Ultra is a permanent. But there'll be some things that we do treat, and they'll say, is this good? Like after that, and I said, I don't think anything in life is permanent. Everything has to be repeated. If we look at house, car, body's no different. There's a maintenance that you have to keep up, and preventative as well. So
if we could stop time, and your exposure to sun, to the elements, then obviously we could, say those things, but we can't. So that's exactly right. We're going to get you on a plan to address those concerns now that bother you, but then we're going to put you on a maintenance plan to prevent those from coming up, right? I mean, you're going to be out in the sun. We're all aging every, second. So we can't stop those things, but we can definitely help, slow that down, and definitely help the skin age more graceful.
And all skin types and all year round. And again, you should always wear sunscreen, and right after it, of course, you're going to want to even be more protective, but still everybody should have sunscreen on and protective. You're right, because exposure to sun, you can get all the procedures in the world done, but if you don't wear your sunscreen,
that's exactly right. Yeah, you have an IPL or an ultra or whatever it may be, right? You can name a million different procedures, but if they know they're going to be at the beach a few times this year and don't take care of their skin, I mean, regardless, they're still going to have things that come back up just as we age naturally. So again, we can address things and help keep the skin healthy and manage it as we go. But it's maintenance is key. So
skincare and sunscreen, and we want you to live life for sure. go out in the sun, but, limit it. Maybe not peak hours. Definitely wear your sunscreen. Sit under an umbrella. No baby oil and beach. Not we
anymore.
Didn't even know better when I was young. That we had no education on baby oil and out in full exposure was.
Well, luckily now we're much smarter and we have technologies that can address problems. Yeah. Way better than ever before.
I love that. So, and then products that you can put on after. I know that you guys have four different, great, not the hair product, but the post, so one has, or if you want to tell us about them in what they're treating. So I know that, for instance, tranexamic acid is not something we have in any other product. So I love that one. Mm-hmm. And you're talking about pigment for that. Mm-hmm. So maybe talk about that and then just the other ones, because those are things that you can actually add on. So we can say, we talked a little bit about PRP and you can draw PRP and put it on, but you also have great products that you can put on post-procedure.
Yep. So we have 4 different ampules that you guys can add, just like combination therapy. And all it's going to do is just take that patient experience and outcome to another level. So, but what's nice with Lutronic is that we actually manufacture these. And so it is a Lutronic, product that only a Lutronic owner can get, right? So they're coming to you guys for an Ultra treatment, an UltraGlo treatment, and then you're able to add to it with some of our ampules. So we've got 4, the RS, the TA, the VC, and the VA, which are, just different vitamins, right? Whether you're wanting to address pigment or skin laxity, wrinkles, just overall health. So it really depends on obviously what their, what their need is, or what they want to address. But it just is an added, kind of benefit to the treatment to make the overall. And now it's going to
penetrate
outcome.
Again through all those microchannels. So
the Ultra preps the skin like nothing else, and so it just makes it like a sponge, perfect to absorb these nutrients. And so you definitely have the options of using the Lutronic products, and then obviously you guys have relationships and other products and things that you love that you can do post treatments with, but it definitely makes it nice having the Lutronic ampules that we can kind of add and further the results.
And I almost think there's 2 that I would use for pigment, like the C and the tranexamic acid, and then A for almost like think about retinol or vitamin A products for wrinkles, fine lines, and resveratrol.
Yep.
Which is, so they're all great products to put on. So definitely something you can talk to your provider about with those procedures and add them on. And we'll talk to you about that as well. Anything else you think we haven't covered at all? Samantha? You've had it done. What do you think?
Yeah, there's nowhere for me to join it. No, I think you guys went over it all. For the most part,
Yeah. And again, the younger patients love it. And so, again, their skin looks great after, and they don't have discomfort, which is a huge thing for them, and no downtime because they're ready to go right after. So,
unless you're a texture person.
Right. Yeah. I would just say that, we can treat all skin types all year round. So it doesn't matter if you have any textural or, tone concerns, then
I think the melasma thing is huge.
It is.
Because people always are complaining about that or wanting to find something and nothing is. So I think that is a huge thing about the Lutronic laser.
Yeah.
And you think about it too, like active acne, right? So, that's a phenomenal treatment we can do with the Ultra as well. So you've got your pigment, your tone and texture, your active acne, your hands, we were saying the neck, the face, and the chest, your hands, you could treat anywhere on the body.
So talk to me for a couple minutes about the acne too, because we've been, again, exploring, it's kind of like the hair, always kind of fine tuning exactly our protocol for treating active acne, not just scars, which are, I think, a little more straightforward.
Which this would help with as well, right? This is combination therapy, with our microneedling, again, going deep and then working out, on the more superficial aspects of it. But basically what we're doing, we're able to put heat into the skin, right, and kill that bacteria, but definitely see some improvement with active acne. So it's just anything that has to do with the skin that may trouble you or you might have an issue with, the system definitely, there's a possible, treatment for improvement for it.
Yeah. So. And you don't feel like they ever get acute worsening of it. Seems to me like with the RF microneedling a couple times I've seen some active acne, not that it stayed and it's not an issue, because I still think that's a very important treatment for active acne, and even getting at the sebaceous glands with heat. But you don't feel like they ever get an slight increase in acne before it resolves, or no?
No, I mean, granted, if somebody does not have an issue with acne per se, go into a treatment, right, then they might have one or two bumps or something come up kind of as your body and your skin purges. I mean, that's just natural, I think, with any procedure that you would have done. But no, not from what I've seen. Typically, we're getting, good results just to help, obviously, maintain it, right? We're not, getting rid of it, same way with melasma, but it's just a great tool that you can just help you maintain.
Well, and that is important, because I think those were even outliers that we did see that happen, because obviously, I think that the RF microneedling is great for active acne and scars, and so is this too. So works with scars. And then, again, so if you have any other thing that you want to ask us about these Lutronic treatments, Lutronic Ultra, Laze MD, UltraGlo treatments, then please just comment, make sure you like and subscribe, and if they want to make an appointment, Samantha,
you guys can call or text the office, and we can get you in for a consultation with Dr. Durst or one of our estheticians to go over how Keralase can help you with hair restoration, how laser resurfacing is a fit for you. So there's lots of options with this laser.
Well, thank you, Matt, so much for coming and clarifying everything about these services and letting us gather more information, pick your brain. But definitely, if you guys have anything else you want to talk about, let us know. Leave it in the comments, subscribe, share with friends. And we're here to talk about all things wellness, aesthetics, and sexual wellness. And again, we're here to revitalize your look, your health, and your sex life. Thank you.